The ICP Falls initiative has come about from the East Belfast ICP, and it's looking at patients who have had a fall in their own home and looking at alternatives to hospital admission. So it's been joint working between the Trust, General Practice, NIAS, Public Health and the community groups to start to develop alternatives to hospital and ED attendance and hospital admission, so that patients can be safely managed in their own home and prevent future falls and future complications from those falls.
We work in partnership with the Northern Ireland Ambulance Service, who will respond to a call for somebody who's fallen at home. If they have risk assessed and feel that that patient doesn't need to be conveyed to the emergency department, they will then make a referral through to the team, and our response times are that we will make contact with the family or the carer or the patient within 48 hours to ascertain as to the reason of the fall and to invite the patient up to either a clinic where we will have a full multidisciplinary team to assess them in relation to their risks of falls, or if they're not able to come up to a clinic, we will provide a domiciliary visit to them. The team is made up of physiotherapists, occupational therapists, nursing and falls assistant practitioners.
One night I woke up with a terrible thump and my wife wasn't in bed beside me, so I got up to see what had happened, and I discovered her lying unconscious at the bottom of the stairs. So I phoned for the ambulance and she was taken off to Dundonald Hospital. Now, there was no permanent damage done. She was discharged the next day, having been kept in overnight and various tests done. With some interest, given what happened to my wife, that whenever I was invited to join this integrated care partnership, which had just been set up to look at the possibility of introducing a falls prevention service in Belfast. Once I got used to it, my role was to bring a layperson's view, an older person's aspect to issues, such as what would an older person's reaction be in certain circumstances, and I was able to do that and explain that to them.
My husband John has had a history of falls, and on numerous occasions I had to get the ambulance service out to help me lift him, and he did end up in hospital a couple of times. But the ambulance men, referred me to the falls team in Musgrave Park. The first contact I had with the falls team was by telephone to arrange for someone to come out to assess John and see what help we needed, which they duly did. The occupational therapist came out and built up John's confidence, helped him with his Zimmer aid so that he could walk unaided with it, and also helped us around the house with lots of equipment which were invaluable at that time. It's also very reassuring for me to know that I have the support of the falls team at any time. They're at the end of the phone whenever I need them.